Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release, ASTER specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTER specialty.
All right, Janel, tell me what's going on.
I've been in several car accidents.
Okay, how many?
4.
4 car accidents,
Yeah.
okay.
And then I've, had issues with my back, neck. Sciatic has been going on for a while. I just recently fell in January.
This January?
July,
okay.
And it separated the muscle in my
So you
glute,
strained
and you
your
can
glute
see it
muscles?
actually.
Okay. You totally
Separated. It was a huge, my butt kind of went like this, and then there was like a big indent.
And did
I
you
mean,
do
like that
anything,
deep.
or
They didn't do
just-
anything to it. They gave me
just
an MRI.
Okay.
They said I have a lot of like lower back, lumbar area problems.
Okay.
Slip disc
Okay.
in the lumbar
How long
area.
has this been going on?
This has been going on for a good 5-7 years.
5-7 years.
The pain in the back.
pain, okay.
The leg has been going on with the sciatic and the pain. That's been going on for the past 2 or 3 years, like really bad where it's constant, the sciatic.
So
on the
your
left.
pain is in the back and
In the
it shoots
back.
across to here,
It's
the
from,
hamstring.
across here
Okay.
to, and then these bones here when I get up
It shoots
underneath.
across here.
Yeah.
What about the IT
And then
band?
here it goes down to here.
Okay.
And then now my feet are getting those Charlie horses where they muscle spasms. My toes go straight, and then the palms or the arches of my
How long has it
feet.
been going on?
That's been going on for past couple months now,
Okay.
really bad. And then at night when I lay down,
Okay.
I can't get up. Of course, when I lay down,
So
it takes me a while to get up
the challenge is getting up from bed.
from like a lay down
From
position.
laying down. So is that so you want to use that as measuring your response to the
Yes,
treatment?
I do.
Okay. What else is difficult for you? Let's do actually bending forward,
Okay.
backward.
Now I'm
Let's see.
hypermobile too,
Okay.
so that's an issue too with me because I can do everything. I'm
Is
very
it
flexible. Sometimes it is. I mean, it just depends on what I do. I can overcome, I can overdo it and I can tell. But I'm pretty. Do you want me to slide?
Yeah.
I can go down
And backwards, so no issue with that pain-wise.
This kind of hurts here and
Okay,
here
twist left and right. Your range of motion is actually not bad.
because I'm hypermobile.
Hypermobile. So can you tell me the last 7 years? You said 7 years.
Yes.
What type of treatment you have for you?
I had an ablation on one
You had
on
appellation,
on
okay?
the sciatic on one side, which is gone.
Okay.
I've had physical therapy,
Yeah.
a lot of physical.
Physical therapy.
Just got done with physical therapy
Okay.
from March to April.
Wow. Okay. But you still have the symptoms.
Right,
Okay.
exact same. Nothing's
Okay.
changed.
What else you have?
Let's see.
Ellen, we're not gonna do the full mode.
Lots of massages.
Massage, physical therapy. What else?
That's pretty much it.
So everything we do should not aggravate your symptoms, okay? We're going to be testing now. I will have you lie on your back or whatever the position that's not comfortable for
Okay.
you, and get up and we'll rate your pain level. How much pain you feel like constant? Do you have
Constant.
pain?
Yes, it's a constant. It's probably around a 4 constant.
4 constant.
But on the days that it really flares up, well, when I get up out of bed, it's a 10.
10.
Yeah, it
So-
just feels like my whole, everything's gonna rip out.
Okay.
And turning hurts.
Turn on the back.
Like if I'm in bed and I go to turn over, it usually wakes me up immediately.
Okay, so let's do the lying down. Just imagine this is your bed, okay? It's not as uncomfortable. Okay. So, and you will rate your pain. Just get the whole body.
Lay down.
Okay. And so we'll have you do the turning and get out of the bed.
This is usually what I have to do. I usually get up on this side, so it's a little different. Really, literally.
So you're using your elbow so you don't use your abdominal muscles.
Yeah, basically, I'm using everything but the back area.
The
I have to
area.
flip.
Did you
and
see
then
this? Let's get the
swing.
side. Okay. Sorry, we're gonna do it a couple of times too,
Okay.
because I want to analyze it.
And
Okay.
I'm gonna lay this way,
Sure.
so I
Yeah,
can,
yeah,
because
yeah.
that's usually how I get up.
Yeah. So you see, she's using her elbow to lower her body.
Yeah.
You know, and then we're gonna have you turn and so look at her elbow. Look at this. So she's not trying to use her core muscle. She's using her elbow
I
and
have
her
to push
hand.
myself up and then put my legs
How
down.
much pain from 0 to 10?
Actually, it's not real bad right now. I don't know why, but it's not.
People feel better when they see me.
Yeah,
Just
that's probably why. Usually that's how it is, but it's about a 7.
7. Where do you feel it in that 7?
In this area too,
In that
in the
area.
lower
Okay.
area and down in here.
So, which position is more comfortable for you to do for treatment? So
It doesn't matter.
it doesn't matter. It's just the transition from
It's
lying
just a
down.
transition of getting up
So,
and down.
okay. So
And sleeping,
and
basically.
sleeping. Okay. So I will have you actually lie on the left side
Okay.
here, so I can work on your head and.
This
your
is the side that hurts, so yeah. So I'll be on
So
lay on
the right
side.
side, the right side. Yeah, that's correct. Okay. So we'll have you lie on your right side, so I can work on this, and make sure whatever I'm doing is not painful.
Yep.
Yeah. That's it, just go over the information.
That's it?
She has information. Core stabilization.
That's it?
Yep. So, let's see. The back. So you had just the appellation. Did you have any other surgeries in the stomach or the back?
I've had gallbladder, appendix, and I just recently had my cone right here in the lower stomach.
Okay. So, is it big scar?
Yeah, it crossed. But I've been rubbing it and
Okay.
doing all that stuff to it, so.
You let me know. Are you comfortable at work in the stomach?
Yeah, that's fine.
Okay. So you had massage, you had physical therapy. Okay,
Mhm.
let's see. Is that too much what I'm doing?
No, it actually feels good.
That's good. Okay. You have a lot of tightness here. So this is the glute that you strain.
Yes.
Okay.
It
And
looks a lot better than it did. But you can still feel the dent in it.
the dent. Okay.
So there's a lot of scar tissue up top.
In there. Okay.
Yep.
Make sure that's not painful. Okay.
It's not painful.
Okay. How does feel?
Good, actually.
Okay, so I'm just releasing your back and then I'm gonna work on the scar tissue. So, do you have any issue here? You feel this scar tissue here?
Mm-hmm.
So you're feeling like a band that's wrapping the back.
It just feels like something, it just feels like it's gonna pull out. Like all my bones are gonna pull out.
Yeah.
It's not giving me any range.
Oh, range of motion. Okay. So I'm gonna work now on the scar tissue. Get this done.
And I know I have scar tissue here on my hip. It's right there. You can just feel it even when you
Yeah.
touch it.
You feel that here?
Mhm.
You can see this. This is a
Right
big
there.
knot here, scar tissue here. So I'm gonna. You see the jumping redness too here.
I can feel that.
You feel that?
Ooh,
Sorry.
it's sore.
So what about here?
Yeah, it's a little sore, but not bad.
Make sure it's not painful, okay? And here a big scar tissue here. You feel that?
Yes.
You see, it's going like this. Here, scar tissue. Let's see what else. Make sure that's not painful. And here too.
Wow.
Yeah. So you had 4 motor vehicle accidents. Did you fail on your back or?
I didn't fall. Well, I didn't fall on my back. That
Sorry.
was sore.
Sorry.
That was super sore.
Mhm. And here too, you feel that?
Mhm.
Okay.
good.
This is here. You see here, there's not a lot of scar tissue here. How nice and smooth. Okay, compare to this.
Yeah, that's really
Feel
good.
it? Yeah.
Wow.
Yeah. And here.
Yeah.
Sorry.
That kind of tickles.
Oh, yeah, it's
I
fun.
can feel that big time right there.
It's fun to be here. Yeah. We not try to tickle patients, but you know, patients enjoy being here.
Yeah, that's really big right there.
Yeah.
That's very tissue.
Yeah. Too much? But you feel that grinding
I
there.
can feel it.
Yeah, and here. Here. That's the iliac crest. We have a lot of scar tissue
That one's
here.
sore.
Sorry. Okay, let me get some more lotion. Mhm. Okay. Make sure this is not too much, okay?
Okay.
And I'm gonna do your hamstring after that. That's fine. Okay, so let me clean this up. Okay. Get the towel here. Okay. While you're here, I'm gonna do this hamstring, okay?
Okay.
Excuse me. Sorry. Make sure you get my face too. Just back and forth, you know.
Yeah.
Is that too much?
Yeah, that's a little much.
Make sure you tell me, okay?
Okay.
You feel this?
Yeah, I can feel it. It doesn't hurt bad.
Do you feel that?
Yeah.
Yes.
That's a correct answer. Yes. I feel it too. Wow, your artiback's tight.
Uh-huh.
Do you feel that?
All the way down.
Yeah.
Right. Yep.
Make sure that's not too much, okay?
Okay. That is a little.
Okay, sorry. Here?
Not bad.
Okay.
Yeah, nothing's tight.
Yeah, well, you are in the right place, okay? So, let me know if you feel sensitivity there. And you can see this scar tissue is just bump, like a kind of bump here. It's not like too much.
That one a little bit.
Sorry.
It's okay.
You-
Right there, that hurts.
Sorry.
That's okay.
You can see, you guys can see that. You see the scar tissue? That's a big scar tissue here. So you lacerated the glutes. What about here, this area?
I don't know for
Because
sure.
that's a big scar tissue here.
Yeah, that's
Can you see this? You see,
sore.
Oh yeah.
it's the size of like this size.
Yeah. Sore
Here.
there too.
Sorry.
That's okay.
You see, it's actually sticking out.
Yeah.
This
Yeah.
area is sticking out compared to everything. Is that too much?
It's not bad.
Okay, make sure it's not painful, okay? You see here, it's flat compared to this area. Yeah. Make sure that's not too much, okay?
Yeah, it's feeling better.
Okay. What about now here?
It's a little sore.
Sorry.
That's sore.
Alright. Did you do anything to your quads?
No, I don't think so.
Okay.
We don't remember how we hurt ourselves.
Yeah.
Yeah. And you said your calf here, yeah?
Yeah, it's not bad in my calf. It's mostly up top.
On the lateral side?
Yeah, but it goes. It's mostly up top, but it goes down there sometimes.
Okay. So this is not too bad here. Okay.
That and my hip.
What happened?
I said that, and right here on my hip is where it's super sore.
Okay. Let me get this spot. Can you get me down, please? Right in here? Where?
Right. And
Okay.
down area. Right on my bone almost.
So your hip bone. Okay.
Thank you.
Yeah, okay. So it's right in here. Wow, feel that?
Yep.
It's crunchy.
It's a little short, but that's okay.
Uh-huh.
I want it to go away.
Is that too much here?
Yeah, that's good.
And that's very crunchy.
Mhm.
Yeah. This is the area.
Yeah.
Is it going down more?
Yeah,
I can see
it's-
scar tissue here. What happened here?
That's where it always hurts. I don't know.
There's a scar tissue here. There's like a shot you had or something like that. Or...
No, that's a I fell through when I was little. That's where I had stitches,
Oh yeah, you can see the stitches here
Mhm.
actually. Yeah.
and it's actually numb there.
Numb?
Yeah.
Okay,
where
let
the
me know
stitches
if
were.
that's changed after.
That's sore.
You can see. Sorry, you can see the.
Scar tissue around that for sure.
Yeah, the stitches. It's like
That's
Man.
we were just talking about that. It was one of
that's
my-
very interesting. They
Like
just
10?
had 10 stitches.
Yeah. It
Look
was
like
when
more than that.
I was 10. think.
Yeah, I can
Yeah.
see the. Wow,
Hmm?
they mark you for life.
Yeah, I fell through it. Our front door.
So what happened here? So you landed on the side here.
Mm-hmm.
You torn your muscle here?
I tore my muscle in my butt. Right
Why the stitch here?
here. Oh, that's when I was little.
Okay.
I was like 10. I fell through a glass door.
Oh, so
Mhm.
you already had the. If it's a big opening, they have to do the stitches. Yeah. Yeah, I can see that. So I'm not surprised. That's a risk factor for more injury, and you feel that's a big scar tissue in the entire area here.
Mhm.
Okay. Okay. So let's actually lie on your
Right.
stomach, back.
Okay.
Yeah. Okay. So you're comfortable to work
Yes.
on your head. Okay, relax. Okay. So in here. Relax.
I know you'll feel a bunch right up here.
What?
You'll feel a bunch right up in there because that's where that laparoscopic was,
Okay.
and I could feel it. A knot in there.
Did anyone work on your stomach to loosen up the stuff?
I never knew it.
Just chest. Okay. Also, you're comfortable like that?
Mm-hmm.
Do you have issue with breathing or eating?
Mm-hmm.
Wanna just let me know when you get up if that made a change to your
Okay.
breathing, okay?
I have a lot of digestion,
You
like
have what?
heartburn all the time.
We're gonna work on nutrition after this, okay?
That feels different.
What do you mean?
Like it just feels looser or something in there.
You feel the tightness here?
Mm-hmm.
Yeah, let's start to loosen up. You see, I can go deeper now.
Mm-hmm.
There's no
Big
difference
time.
to do that. Feel it? That's good. And here, do you feel how loose this
Mhm.
compared to this? This is very tight. So we're gonna release that. Okay. Too much?
Mm-mm.
Okay.
Wow.
Okay. And here, you feel that scar
Mhm.
tissue here? That's very tight.
Yeah.
You try to avoid. So how long?
Since January.
January this year, after you
Fell.
you
My
feel and you
initial fall.
strain your. So you had the back pain for the last 7 years, you said,
Mhm.
and
And the
then
hip pain.
and the hip pain, but this was the make things worse.
Mhm.
You had that trauma.
I can already feel the difference laying down
How you feel?
better. The back, my back feels better.
I
The
start to
bottom.
lose. When I worked on the stomach,
Mm-hmm.
why they don't work on the stomach? There's no training for it. Well, there's a few training on it, but I don't know how that's effective to release the stomach.
When does he work? My back doesn't look like this.
Is that too much?
Mm-mm.
Okay. Okay. So I'm gonna put some. You're gonna feel cold here, okay? All right, so just mess up everything here. Feel that bone here, okay? And, okay. Yeah, you get like a lot of scar tissue. Actually, I feel it this worse than your elbow crest.
Really?
Here, yeah, like really a lot of scar tissue. When you feel like too much bumpy here, you know.
And that could be pulling away back too, right?
Well, this is gonna pull this way, so you're gonna
Mhm.
compensate in the back.
And they sit funny too. all day.
Yes. So you know it's all connected, and
Plants and
oh no.
overseas.
That's good.
Yeah, right.
They've
Oh,
actually done one.
Oh man. Okay.
Ew.
All right. Let's focus on this. You feel that scar tissue?
Major scar
Yeah.
Right there.
And here,
Mhm.
see the whole thing. Okay.
That's right, where my surgery
You
was.
feel that?
Yeah.
Yeah. It's a lot of scar tissue. Yeah, I'm not really surprised why you have back issue. Actually, I think the front is actually big major
I
factor
probably have
to the
a
back.
lot of scar tissue. I lost like 60 pounds too.
Good job, I'm proud of you. Yeah.
That's hard.
Good job, that's awesome. And you feel that? Huh?
I knew there was a bunch up there. I could feel it
Yeah.
because I've had one, two,
Usually,
3 laparoscopic surgeries.
man, your body got the scar tissue.
Mm-hmm.
Because in perfect scenario, the body actually should get rid of the scar tissue by itself. But, you know, when we get older, the ability of the body to break the scar tissue decreases significantly. You add to that, like if you have genetic predisposition or, you know, any comorbidity, like, you know, diabetic or high blood pressure or smoking or something like that, the body works a little bit slower to break things down. And you feel all of that.
Actually,
You feel that?
that one I really could.
Yeah. Okay. We're gonna work more on this, so
Okay.
we'll get back to this. Okay, so let's actually, okay, you can pull this down, and let's do the getting up. And how does it feel?
So I just try to.
We'll do the same
Get up
way,
normal?
the same way,
I'd
or,
rather just try to get it normal. That's a first right there.
okay, how's
I
that?
haven't been able to do that a long time. Yay!
Okay,
But it's still caught
where it's caught.
right here.
Okay, let's do it normal without your elbow and see.
Okay.
Because you were doing your elbow to compensate.
Mm-hmm.
Okay,
That one still hurts though.
where?
Right here. It's
Right in
all-
this,
Yeah. Right in there.
right in here.
Oh yeah.
This one, yeah?
Yep.
Okay, relax, relax.
It's great to know.
Relax.
It's caught though.
Breathe, 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 okay? Think about something you like. What do you like?
Taking pictures.
Okay, so take a picture, okay? What do you like to take a picture of?
Nature.
Nature? I like nature too. Okay. So what's your favorite place?
Back home in the woods in
Where do you live?
Missouri, but I'm here now. For a little
okay.
while.
Yeah, you
Torrey
guys have,
Pines is my favorite.
yeah, that's nice. You guys have a lot of natural like, beauty. Yeah, that's good. Is it too much?
Mm-mm.
It's right in here. This
Yeah,
this
and
is
then
this way.
it's in the bone, like right in across there too. It's where that catches, and then underneath those
Right
bones.
side.
Which side?
This side, yeah. And put this. But here is the thing.
But at least I sat upright.
You are moving faster now.
Yeah,
Yeah, that's a good sign.
very good sign.
Okay. So it's in here. One second.
It's here. It's right in there for sure. There's one right there.
That's a big scar tissue.
Yeah.
That's
And then it catches this bone, these bones.
okay.
That's a big one.
Well, yeah. Is that too much what I'm doing
No,
here?
not at all.
I told you last night, it was his fault. He's not letting him down. You know, he get up in bed and I'm on the edge, and he's like,
Here you said? Where?
It was right in there. and then,
Oh wow, you feel this one?
yeah,
Okay. Let me know if that's too much, okay?
okay. It's good.
We're not doing surgery here, okay?
Okay.
Alright. Okay. That's a big knot. You feel this one?
Mhm.
It's actually my fingers just sliding over it. The thickness of that knot is it's very thick. Yeah. Okay. Feel that here?
Mhm.
Okay, let me. Okay. Make sure what I'm doing is not painful, okay?
It's not.
Alright. So. We're gonna break this one, okay? Is that painful?
Kind of feels like you're, doing checking for reflex in your knees.
What?
Feels like, kind of like just like you're checking reflex.
Okay. No, I'm not, I'm just doing something else with it. Yeah.
I can feel that in those bones down here.
Well, you feel what? The tightness?
Yeah, that when you hit that,
Okay.
that's where I could feel it.
It's a big knot. Excuse me.
Your pulse and she's out now.
Too much? Is it too much?
No.
Okay, we're gonna revisit this one. Okay?
Okay.
Because it's a thick and it's a hard one.
It's a big one.
It's a big one. Okay. So let's try it again.
Don't use my elbows.
Well, do it your original way and the other way.
Go inside.
Can get it from here. How'd that feel?
A lot better.
Okay.
Oh,
Okay.
stick with
How's that?
That's much better.
Let's actually stand up here and bend forward and tell me and facing us.
Oh.
Yeah. How's that going down?
It's a little bit
Mm-hmm.
more stiffer. I don't know why.
More stiffer? Okay.
That was it first.
Can you get some water, please? How's the
Felt
back?
better to get up. Feels better.
Okay. So let's
I
actually.
think my hip doesn't burn right now either.
The constant pain, how much now? From 0 to 10. Make sure we drink enough water because you have a lot of scar tissue. I did a lot of release. That's release a
my
lot of
hip.
toxins.
Is the good one. It doesn't burn.
It doesn't burn?
There's like a 0 on the hip right now.
Let's drink some water.
0 on the hip.
Yeah. So bend forward and tell me how is the stiffness now? How's that?
It's not bad.
Okay, let's actually lie down again, and I want you to tell me how you feel speed-wise, overall.
Let me get it so it does whatever it does when I first
Okay.
go down.
All right.
Okay. Well, right there is a big difference.
You're moving faster. Did you notice before she was like on her elbow and her
Yeah,
wrist?
I've never been able to sit up like that
For how long?
since January.
Okay, that's
Ever
beautiful.
sat
That's
up
good.
Like that. I'm gonna
Yeah,
cry.
yeah, that's awesome. I'm glad you're doing better.
You
Yeah,
have no idea.
yeah, that's beautiful.
I'll do it again.
So she's trying it again. That's good.
Excited.
Yeah, I'm excited too. Yeah. Look at that. That's beautiful. Yeah.
Okay.
Oh, you doing crunches now? Are you trying to show off now?
my
Look at
gosh.
that. That's beautiful.
Oh my gosh.
Yeah,
Thank you so
yeah,
much.
yeah. I'm glad you're doing
I
better.
have no idea.
Yeah,
That's awesome.
awesome.
Okay.
Yeah, good job.
We're gonna work on this other big one, right?
Yeah, we'll do that.
Okay.
Thank you so much.
Thank
yeah,
you.
thank you.
I'm
What do you
so
think about the treatment? You had PT before,
You know,
you had massage.
I've
so
had everything before and I've never been able to sit up. Even
Yeah.
after a massage,
Yeah.
it takes me a long time to get up off
yeah,
the
it does not
table.
break the scar tissue.
Mhm.
Yeah, yeah,
Thank you.
yeah. Awesome.
Tears.
Yeah.
Yeah, I
Yeah.
know. That was
Yeah.
amazing. Right
Awesome.
there.
I'm glad you're feeling better.
Thank you
yeah, well,
so much.
glad it's
Okay.
working. Awesome. Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTER certified, you can follow the link below. You will get information on how to register for ASTER online class. There's over 40 studies that support ASTER treatment model, and also there's over 400 studies that utilize by ASTER treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.